physicians would be, supported with AI agents in order to get to certain insights much more efficiently than they ever have been.
So, Roland, when you think about diagnostic imaging and AI, it is sort of extraordinary the fact that 70% of AI tools approved by the FDA are within imaging. So where do you see sort of the direction of this, given that fact?
Yeah, great question. So first of all, I would say, imaging is a very demanded capability. So imaging plays a role in all kinds of diseases, neurology, cardiology, oncology. And so more and more patients need imaging. And at the same time, there are, resource shortages and there are access shortages. So AI can help to increase actually access and actually increase also the throughput for healthcare systems and healthcare providers to ultimately handle more patients, handle the demand, and do that confidently and efficiently.
We see healthcare systems clearly investing in AI. Some are doing it really well. Some need to learn some lessons. From your perspective, how is this investing changing?
Yeah, so GE Healthcare actually started pretty early to adopt AI and help healthcare systems to understand, to bridge that value to creating efficiencies. So what we are seeing is that when we have tangible value, like an MR exam can be cut from 40 minutes down to 20 minutes, with the help of AI, that is something which is very tangible. More patients can be handled. The staffing shortages is better under control. So these examples actually convince customers to really invest. It is also about making sure that the whole demand they have in their entire system is better coordinated and they can ultimately meet this significant patient volume, with the resources they have.
You said something that struck me. Reducing MRI times from 40 minutes to 20 minutes.
Right.
That seems amazing. The practical implications of that from a day-to-day patient care standpoint would be what?
Yeah, so essentially it means throughout the entire range of imaging devices in GE Healthcare, we have more than 150 medical devices, which are all now with embedded AI. And what this AI is doing is make this workflow, make all these steps more efficient for physicians. So it cuts in MR, again, this scan time can be reduced by, say, 50%. In certain other, capabilities, it can mean an instant warning that there is a pneumothorax in chest X-ray as an example. And so you see alerts and you see a more efficient handling of a patient. And in that sense, healthcare providers actually can do their work in a smarter way. They can do it in a more efficient way.
Speaking about doing things in a smarter way, this is such a disciplined moment for healthcare innovation. When we think about partnerships, who you're choosing to bring into the fold to care for patients, how do you evaluate those deals, whether they're with startups or with academic institutions? What's the metric here?
So first of all, we work with, the entire ecosystem. Technology partners such as NVIDIA very closely, innovating together and creating more autonomous solutions like autonomous imaging. We work closely with customers who are at the core of these problems and serving patients every day. And third, obviously, we work with smaller companies which have great ideas and ultimately be an integrator and be a partner for them to bring it to bring access to all these customers.
So as you work with them, how are you determining who you're going to work with? Obviously, you have so many options beyond the companies that you've listed, but you chose them for a reason. But generally speaking, how do you do that?
How we do that is we evaluate whether 1 + 1 is more than 2, right? It's ultimately can be in a combined way bring more value to our customers than not, and that is a key factor. And I would say the other factor is about, again, what problem are we solving? And in that sense, there's a lot of innovation now happening in the space of AI, but also in advanced medical devices, doing therapies in a distinct way, where putting world-class imaging together with a world-class therapeutic capability just gives more access and, reaches more patients.
And finally, the future of imaging with AI. 70% FDA tools tied to AI, but the future?
Well, the future will be even more autonomous AI kind of enablement, not only in devices, but really for entire systems. So think about a patient could ultimately, do certain aspects of the medical imaging guided, like in an autonomous fashion. And physicians would be, supported with AI agents in order to get to certain insights much more efficiently than they ever have been. So it is really helping both patients as well as the healthcare providers to attend to these opportunities much better.
Getting to insights much more efficiently than they ever have been. Thank you so much.
Thank you.